Following the deaths of 6 people with a learning disability in NHS care, Mencap published a report called Death by Indifference, which highlighted the unequal healthcare that people with learning disabilities often experience within the NHS. Sir Jonathan Michael's Healthcare for All was published in 2008, and although the inquiry team found many examples of good practice, they also found convincing evidence that people with learning disabilities have higher levels of unmet need and receive less effective treatment. In a press release in July 2013, the Care and Support Minister Norman Lamb said, "While some improvements have been made, people with learning disabilities are still experiencing poor care and face unacceptable inequalities in health and social care. Many of my friends and I often receive excellent health care from a fantastic NHS staff, but sometimes things don't do as well as they should do. Please help us to address the health inequalities that exist. Thank you."
What kind of service
do you think
people with
learning disability
receive from the NHS?
I think the quality of the service that the people with learning disabilities receive will continue to improve as long as we maintain the profile and the understanding of the needs of people with learning disabilities, the sort of adjustments that are necessary. If you've got learning disabilities, you may just need more time to discuss what's going on with your doctor or to understand what's happening. Understanding the reaction of people with learning disabilities to treatment and to operations or to drugs. Staff need to understand that. So I think the quality of care for people with learning disabilities is probably better now than it was when I did the inquiry, but it's still got a long way to go before it ought to be the same for people with learning disabilities as it is for people without disabilities. There should be no difference.
What message would you like
to give
hospital staff
regarding the
treatment of
people with
learning disability?
People with learning disability, particularly people with significant learning disability, are some of the most vulnerable in our society. And so if we can look after them properly and care for them appropriately, make the necessary adjustments that the law requires us to do, then we have a better chance of looking after all people appropriately and properly.
People with learning disabilities may not have the confidence to tell the health professionals their symptoms.
People with a learning disability may say they understand when they don't.
letters should be easy reading and be simple to understand without jargon words.
While in hospital, people with learning disabilities need patience, reassurance and extra time to understand the treatment.
People with learning disabilities may give you the answers you are looking for, but might not help your understanding of the situation.
People with learning disabilities get easily anxious and worry about hospital appointments.
It's not easy for me to look things up on the internet.
Sometimes when I explain something, my story can be confusing.
Family members or carers may also have a learning disability.
Hi Elaine, I'm Tracy and I'm Vice Chair of the Trustees for My Life My Choice and the Health Champion.
Tracy, it's great to meet you again and good to talk things through. I'm wanting to ask your first question about how we approach someone with learning disability. Sometimes as healthcare staff we're reticent, we're a bit scared of asking you, have you got learning disability? How should we ask you?
We get a lot of feedback from them to say they want to be asked. They'd rather be asked than not asked, because then it makes them feel that they're not ashamed to have a learning disability, and nobody should be ashamed to have a learning disability.
So just to say, have you got a learning disability?
Yeah.
Is there any special needs that you want us to take into account?
Yeah, yeah. So they know you're doing it to help.
Before someone comes into hospital, we as a hospital might contact you by a letter or by telephone. How should we approach that?
It should be an easy read, because that helps us to understand. And if that person has a sight problem, it might need to be large print. And just make it easily understandable, no jargon words.
Right. And I do know that we do have some of our letters for people coming in for an eye operation in large print. The other thing I'm wanting to happen is, if you get a letter that you don't understand, that there's someone you can ring in the hospital to say, I've got learning disabilities, I don't understand, can someone talk me through it? So Tracy, are there some other things that we ought to be thinking about when we set up an appointment or a procedure for someone with learning disability?
The time needs to be thought about. We very often have early appointments, which is impossible to get to. And so we need that to be a more late of appointments, realistic times. So they need to realise that they have to get there, right. Especially if we live out of the area of the hospital. And also longer appointments, you know, GP appointments about 10 minutes. Hospital appointments aren't usually that long either. And someone with a learning disability has to know what's going on.
Right. So once we realise that someone has a learning disability or other special need, it's important that we then plan in a longer appointment, come in a bit late, opportunity to come in later if you have to use public transport, and then take the time, be really thinking about what we say so that a very small comment doesn't worry people.
Yeah.
What's the best way of really understanding an individual? What makes someone panicky, what people like, what they don't like?
Well, I think the hospital passport's a very good thing. Is you put all your allergies on there. I've had an experience where I was given antibiotics that I was allergic to. So if that happened, if the hospital passport there, that won't happen. And you could put down there if they suffer from panic attacks, anxiety. You put down their learning disability, their physical needs, their sight problems, hearing problems, and you can put all that down and then you can give that, you know, take that in hospital with you, and that instantly then your staff will understand.
So we're saying that the hospital passport is really important to help understand all about you.
Yeah.
Everything about you, that how to help you not to panic, how to help you if you are panicking, how to understand the things that are more stressful and the things that make you happy. Can we talk about going home?
Yeah.
What sort of things are important in thinking about going home from hospital?
Sometimes we're told we go home and then suddenly you come around, no, you can't go home now.
Oh.
And that needs explaining, because somebody with learning disability will think, oh, I'm going home, yeah, no, lovely. And then you're disappointed. And again, with autism, that's a big problem, because it's a change again. And we're often given leaflets following an operation of what you have to do. One thing, it needs to be an easy read again, and another thing, so we with a learning disability will follow what's on that paper to the tick, yeah? So it needs to be, if it's guidance, it needs to be put, this is a guidance only, you know, don't panic if you don't do it, because, you know, it's only a guidance.
So being really clear and saying things like, these are some of the possibilities, very unlikely to happen, but just so you know, if this happens, tell your doctor.
Yeah.
But very unlikely.
Yeah.
So I repeated that it's unlikely, and also to be saying this is about guidance.
Now we know that people with learning disabilities often have complex health needs. They might have lots of different agencies and carers and different health professionals involved in their care, and they may not always have capacity to make decisions about their health care. So we've developed a document called a hospital passport. It's a really important document that's owned by the person. That's something that they will have been able to complete with carers or themselves. If somebody comes into hospital with a learning disability, or in fact with any other particular support needs, you could go to the intranet site for learning disabilities and you'll find a copy of the hospital passport that you can print off and either fill in with the person or ask a carer to help. There are 4 sections in the hospital passport. There's the first section, the red section. It's a section that can be read particularly in an emergency situation. So the information that's in there will tell you about the essential people that might be involved with the person. Then there's the yellow section, and the yellow section will tell us about how we can support people, particularly if they're admitted onto a ward. It will tell us about how they might communicate, usually whether they use words or pictures. Then there's a green section, which is just a really useful pointer around things that somebody usually particularly likes or doesn't like. So usually we ask people to put in there things around whether people like lights on or whether they particularly like a door open or a door shut. Sometimes people have very particular likes and dislikes, which when they're in hospital can make somebody very anxious or very unhappy if we don't know about them. There's then a blue section, which is really useful. It will tell us about what somebody's carer may wish to do when they come into hospital. So it's really important that the hospital passport is somewhere on the person or on the ward where all the staff that need to see it can read it. It's really important that it gets read before care is offered. And if it needs updating, do go ahead and update the hospital passport with the person or with carers as needs change, or you are aware of needs that maybe weren't highlighted sufficiently within the hospital passport. Because it's owned by the person, then also when they go home, please give the hospital passport back to the person for them to take back home with them. That way we can ensure that if they are readmitted at some point that they'll be able to bring it in with them.
Carers Oxfordshire is an organisation that provides information, support and advice to carers aged 18 and over living in Oxfordshire. The cared for person also needs to be aged 18 and over, but actually doesn't need to be living in Oxfordshire for the carer to receive the support from the organisation.
Well, I'm Graham, and for the last 5 years, since Angela was diagnosed with Alzheimer's, I've been her full-time carer.
One of the important things is at a very early stage is to be able to identify the carer, to acknowledge that there is a carer, and to ensure that they are part of the process, very involved in discussions around the care of that person and that patient. Often they're advocates for the person, often they have actually more knowledge of the patient's condition than the patient themselves.
Please be aware of our concerns as the patient and carer, that we need to know what's going on to help each other to understand, and also to help with the convalescence afterwards.
I think it's really important that we value carers as part of the hospital team. By working in partnership with them, you can provide a really holistic service for the patient.
Hi, my name is Jason Warner. I'm a community learning disability nurse and I work in Oxford City. I'm a member of the community learning disability team, also based in Oxford City, and there are 2 other teams in Oxfordshire, one based in Abingdon and one based in Banbury. If someone was admitted to hospital, we would support somebody through that admission, working alongside the doctors and the nurses in the hospital, with the patient at the very centre of everything. Supporting that individual to understand what's happening, but also to support the professionals who are also involved, talking to them about a learning disability, what it is and how it can impact on somebody's understanding.
My son Matthew is 22 and has severe learning disabilities. He's on the autistic spectrum and he has epilepsy. Because Matthew has no verbal communication, he has had behaviours that some people would find quite challenging in a hospital environment. Because he can't speak, he vocalises a lot, so he can often make very loud noises that some people find disturbing because they don't understand what the communication means. It was very clear because of the severity of his learning disabilities and the problems with Matthew's verbal communication and his understanding of verbal communication from other people that he wouldn't be able to make his own decisions about his health care. So we very much need to be part of that decision-making process as his family carers, because we can then say whether we feel it's in our son's best interest to have a particular procedure or not, or particular tests or not.
Hello, my name is Caroline Heeson and I'm the Safeguarding Adults and Patient Services Manager here at OUH. Firstly, always remember to ask your patient and your carer about what help and support they need. And it may well be that your patient who has a learning disability has a hospital passport. And if they have one, please use it to help plan their care. If they don't have a hospital passport, please ask them to fill it in or indeed help them to fill it in. Secondly, the next message that I have is about making sure that the person who has a learning disability has got an alert on their notes. Either that's a yellow sticker on their paper notes or on the EPR system. This is really important because we want to make sure that people with learning disabilities get reasonable adjustments to their health care. The third thing that I want to say, and I've mentioned this already before, is about reasonable adjustments. Reasonable adjustments are really key to making sure that people get the health care that they need. So please make sure that you do reasonable adjustments for people with learning disabilities. The next key message is about supporting carers. Supporting carers is really key. The Healthcare for All report that Sir Jonathan Michael wrote in 2008 showed that carers for people with learning disabilities often felt that they didn't get the help and support that they needed. And within our trust, we really want to make sure that carers who support people with learning disabilities are supported very well. So please make sure you ask the carer, the person who has a learning disability, what their needs are. My next key message is about specialist help. It may well be that your patient who has a learning disability may need extra help whilst they are an inpatient on the ward. If that's needed for this person, please make sure that you contact the Acute Liaison Learning Disability nurse or indeed the learning disability champion for your area, and they will be able to help. My next key message is about making sure that you know and understand the learning disability protocol, and that you know how to contact the learning disability liaison nurse or the learning disability champion for your area. That's really important and key, because it means then you will know what to do to support your patient who has a learning disability. And my final key message is about the Mental Capacity Act. Please make sure that you know how to use the Mental Capacity Act, so that then you can be sure that you are supporting your patient who has a learning disability well and in their best interests.